Welcome, everyone. My name is Kayla Fowler. I'm the Director of Experiential STEM Programs for the Douglas Project for Women in STEM at Douglas Residential College. Thank you all for being with us tonight and hope that you are healthy and safe during these times. During this time of social distancing, the Douglas Project for Women in STEM and Douglas Residential College is hosting a Women in Public Health speaker series, highlighting the interdisciplinary nature and impact public health has in our daily lives. Tonight, we are honored to have Dr. Tracy Davis, Assistant Professor in the Department of Interdisciplinary Studies at the Rutgers School of Health Professions. Dr. Tracy Davis has 2 undergraduate degrees and a master's degree from the University of South Florida and a doctoral degree from the University of Kentucky. She holds a certificate in applied statistics from the University of Kentucky. Dr. Davis joined Rutgers University in the fall of 2013. She's a full-time faculty member in the Interdisciplinary Studies Department in the School of Health Professions, where she is the aging track coordinator for the aging track in the undergraduate and graduate degree programs. In addition to teaching, she's involved in numerous research projects. The majority of her research focuses on HIV prevention among older adults and disability among those living with HIV. Just a bit of housekeeping before we begin. All attendees have been placed on mute for the duration of the discussion. If you have questions, please send them via the Q&A option or the chat at the bottom right of your screen at any time. We'll be answering questions at the very end, but feel free during the presentation and discussion to post your questions in the Q&A or the chat, and I'll keep track of them, as well as those that pre-registered. I also have the questions for those that submitted questions prior to that. It is now my privilege to turn it over to our guest speaker, Dr. Tracy Davis.
Well, thank you, and thanks for everyone for joining this evening. Please bear with me. My brain is a little fried. I've been doing statistics all day. So tonight I wanted to talk to you about COVID-19, aging, and HIV, hopefully make some sound connections for you. So Kayla already kind of explained my background to you. I am full-time in the School of Health Professions, but I also teach in kinesiology and health. Also in the Global Village, I teach public health. And recently I was appointed a secondary appointment in the School of Public Health. But I always show my dog in most of my presentations because I do love animals and volunteering. So I volunteer at One Love Animal Rescue, and when there's not COVID, I enjoy traveling. So I showed a picture of Greece, one of my favorite places to travel. As far as my research interest goes, I think Kayla mentioned my research has mainly focused on HIV prevention for older adults, but I've also looked at incorporating more aging education into the high school curriculum. So for tonight, I thought I would start off with a little bit of background on COVID. Most of you probably already know this information, but just so we're all on the same page. Then I'll talk about COVID and its impact on older adults, as well as older adults and HIV and AIDS, and then try to make a connection for you between HIV, AIDS, and COVID, based on what we know so far with research. So what is COVID-19? COVID-19 is part of the coronavirus family, which is a large family of viruses, which may cause illness in animals and humans. We've known of several other coronaviruses that range from respiratory infections from a common cold to more severe diseases such as MERS, which is the Middle Eastern Respiratory Syndrome, or SARS, which is this severe acute respiratory syndrome. And now we have this novel form of the coronaviruses, which is COVID-19. And we didn't know about this until December 2019, when we had the first outbreak in Wuhan, China. And so I know you all are aware that this is a pandemic affecting many countries. And just a little fun fact, the CO part of COVID stands for corona, the VI stands for virus, and D stands for disease. So the common symptoms of COVID are fever, dry cough, tiredness, aches and pains. Some people experience headaches. Most recently, they've noted a loss of taste or smell. And then some people present with rash or skin discoloration of their fingers and toes. And then there are some more serious symptoms such as difficulty breathing, shortness of breath, chest pains or pressure, some tightness in the chest. And some people have actually presented with loss of speech or movement. But it's important to know that most people who get COVID do recover without needing any kind of hospitalization. It's about 1 in 5 or 20% that get COVID and develop the serious symptoms such as the difficulty of breathing and those kinds of things. And then also to keep in mind that older people and people with underlying conditions such as high blood pressure, diabetes, and those kinds of things are at higher risk. So how does the disease spread? Obviously, it can come from animals, so animal to human or person to person. So if a person, is infected and sneezes or talks or coughs, the respiratory droplets are dispersed into the air and they can be inhaled by an uninfected person and travel to their lungs, causing infection. So the spread is definitely more likely for people who are in close proximity to one another. And so that's why social distancing is important and trying to stay about 6 feet away from someone that you don't know. Also, wearing masks is extremely important. And it's also important to keep in mind that someone who doesn't exhibit symptoms of COVID can still spread the disease, even though they're asymptomatic. So practicing, hand washing and wearing a mask and those kinds of things and staying home when possible are extremely important. So I mentioned already that there's some groups that are at higher risk. Older adults, people 65 and older, tend to be at greater risk for COVID. Older adults tend to have a lot of underlying conditions or can have multiple underlying conditions. So things like COPD particularly, because that affects the pulmonary system, heart disease, diabetes, again, asthma, things that affect the lungs, high blood pressure, and then dementia. So the reason I had to reschedule this presentation is because my dad's cousin, who had advanced dementia, was diagnosed with COVID, and unfortunately she passed away within days of the diagnosis. So definitely that is something that can happen. So again, limiting your time with others that you don't live with as much as possible, using hand sanitizer regularly. That includes 60% alcohol. If you see somebody not wearing a mask, you want to try to avoid them. It's important, though, that people who are experiencing, these underlying conditions take their medications as recommended and keep their, supplies handy and do not delay emergency care, if you have an underlying condition. So another example is my mother was recently diagnosed with an aneurysm, and maybe a month ago, she was having really bad head pains and dizziness, but refused to go to the emergency room for fear of getting COVID. So it's important to just keep in mind that hospitals are prepared to take patients in and keep them safe from COVID. Okay. So in line with talking about older adults, I just wanted to show this diagram to show the projections for 2035, that the number of older adults within our population are going to outnumber younger individuals, and this will be the first time this should happen in our history. And I don't know if you're all aware, but baby boomers, those born between 1946 and 1964, are aging rapidly, and that is a large population of individuals. So if you're interested in a career in aging, now is the time to kind of jump on that bandwagon. According to the CDC, about 8 out of 10 COVID-19 deaths reported in the U.S. have been in adults 65 and older. So again, this is just pointing out that older adults are at higher risk for COVID and some of the complications. So I don't know if you all are aware of this, but this was in the news maybe a couple of months into the pandemic. The lieutenant governor of Texas suggested that grandparents should be willing to die in order for our U.S. economy to kind of restart and to continue to grow. And this is just an example, I think, in my opinion, of people not realizing the value of older adults. And this can lead to, some different challenges among older adults, and I'm going to talk about those next. The funny thing about this is I'm pretty sure that he is a grandparent, and he's definitely over 65, but I'm not sure that he'd be willing to die for the cause. But anyway, this is just an example of things that can affect older adults negatively. And so my last point that I have up here is internalized ageism. And so messages like that from the governor, a person who's fairly high up in the government, saying, you should be willing to die, is something that older adults might internalize. And then that creates a whole slew of other psychological problems. So things like depression and anxiety. Social isolation has always been a problem for seniors that have physical limitations, that bars them from going out and integrating, and interacting with their friends and family members. But now during the pandemic, it's even more of a problem. Senior centers are closed, and even if you live in a senior apartment complex, the common areas are closed, and you kind of have to stay in your apartment. And that also leads to feelings of loneliness, which can lead to depression and anxiety. We're also seeing some self-neglect, and that can be, mentally not, just sitting there watching TV, not kind of stimulating yourself, or it could be physical, not taking care of yourself in the way you should. We're also seeing more domestic abuse. I have this also listed under physical challenges, but certainly this could be verbal abuse. People are quarantined together, spending more time together. Maybe they're not used to that. And we are seeing a little bit more elder abuse in our older population. Okay. So older adults are also experiencing some social challenges. Again, social isolation, as I already mentioned, but also deaths of family and friends. And they're not even able to attend the funerals because, you can't have a regular funeral. A lot of times it's over Zoom or some WebEx or what have you. And so people aren't able to be there and to grieve the way they normally would. And so that's causing some psychological challenges, not being able to socialize, lack of family visits. So my colleague in Kentucky and I are doing a study right now on COVID-19 and its impact on older adults. And there's a section where we ask them to write in, how they're feeling and what they miss most. And a lot of them are saying they're missing their grandchildren and their children and friends and family. And it's really starting to get to them. And then finally, older adults experience some physical challenges in general with transportation and those kinds of things. But now because of the pandemic, they're afraid to go to the grocery store or get on the senior bus that might take them to the grocery store. So getting proper nutrients and things can be a problem. Also with medications, fear of going to the pharmacy to pick up the medication, but also with the delays in the mailing system that we saw and maybe still are seeing, getting the medications to the seniors via mail, which might be the safest option, is not an option at this time. And then I also already mentioned not seeking medical attention, in case of a medical emergency, fear of going to the hospital and getting COVID, and then domestic violence. So there's actually some physical abuse that we're seeing. Elder abuse is not new, but we're seeing a bit more of it now that people are stressed, maybe financially, and having to stay home a bit more. So those are some of the challenges that older adults might be facing and experiencing more of these things now because of COVID. So I encourage everybody to kind of keep in mind that older adults have a lot to offer, and that we shouldn't just kind of push them to the side and ignore them. We need to remember that older adults have a lot of wisdom that they can share with us. They've been through a lot in life. And my last point here is talking about rationing and quarantine due to wars, measles, and polio. So they might be able to give us some sound advice on moving forward with this and how to survive. Also, older adults provide a lot of comfort, a lot of sage advice that they can provide. They're providing a lot of practical help. So, with childcare, they've been, helping take care of grandchildren, even raising grandchildren for a long time. And that's really important. But also now that children are at home and doing remote learning and those kinds of things, if you do have an older person around, they can certainly be helpful with that. I have a friend whose mother lives in Colorado and her grandchild lives in Connecticut, but she's been waking up every morning around 5 so that she can Zoom in with her granddaughter to help her out with her classwork so her daughter can work. So they really can offer a lot of services. And then volunteerism. I think we often forget about how much older adults give in the way of volunteerism. So volunteering at churches or senior centers or, I volunteered at Action Wellness. They provide services for those living with HIV and other chronic conditions. And half of the volunteers are people over 65 who now have the time to give back. So I think it's important to keep that in mind, particularly in times like these, and do what we can to help older adults. So what can we do to help older adults? I encourage everyone to check in with their older relatives and friends regularly to make sure that they have their medications and groceries. Go and pick up whatever they may need from, grocery store or wherever. And then just call and chat for a few minutes or FaceTime if that's an option, so they can see you and talk to you and, write a letter sometimes, that kind of thing. So I encourage everybody to try to keep older adults at the forefront of their mind, and do what they can to help the population that's probably suffering a little bit more now than some of us. So now I want to kind of transition a little bit, talked about COVID, talked about older adults. Now I kind of want to bring in the topic of HIV, AIDS, and aging. And then I'm going to switch back to COVID and try to make a connection between some of the things we know about HIV and COVID. So I just want to start off with some basic statistics. In 2016, about half of people in the US and our dependent areas living with diagnosed HIV were 50 and older. We do use currently the age 50 and older as an older adult when we're talking about HIV or AIDS. I can see that number moving up some as we are, doing better with treatments and people are living a lot longer. But 50 kind of was the cutoff. People didn't tend to live much longer than that when the disease came around. And then we are seeing some declines in the diagnosis among people 50 and older, but still about 1 in 6 HIV diagnosis in this group occurred in 2017. So we do see more HIV and AIDS among African Americans as compared to other age groups, and that can be related to all kinds of disparities and lack of access to healthcare and things like that. So these pie charts just show the most common method of infection. So for men, 67% are thought to be caused through or infected through male-to-male sexual contact, about 21% through heterosexual contact, 9% through injection drug use, and then 3% a combination of male-to-male sexual contact and injection drug use. For women, large majority comes from heterosexual contact and about 13% from injection drug use. Okay. So in terms of getting HIV, the risk factors are the same for every age group. So unprotected anal or vaginal sex, or sharing needles for injection drug use, or not even injection drug use. Some things I learned when I was doing my research on HIV and aging is that some older people will share insulin if they're getting close to the end of the month and they're running low and they can't get a prescription yet, but their neighbor has some they can share. So some people were doing that and getting HIV that way. But when we talk about older adults, there are some prevention challenges that are different as compared to other groups. So older people here in the U.S. Are more likely than younger people to have late-stage HIV infection when they're diagnosed. And so that puts them in a bad place because that means they're starting treatment late and possibly suffering more immune system damage. So as we age, our immune system's function slows down a bit. And so once you have HIV and a late diagnosis, you're really in a bad position. Late diagnosis tends to occur because healthcare providers aren't likely to test older people for HIV infection. They come in with some symptoms that might look like other conditions that are more common among older adults, and so they'll run batteries of tests, maybe sometimes over the course of a month or months. And by the time they've ruled out everything else and come around to doing HIV testing, it's a little late, and that's why they have that late stage infection. Additionally, older people may not consider themselves to be at risk for HIV infection. They tend to think it's a younger person's disease, or they may mistake some common symptoms of HIV as normal age-related changes. So things like fatigue, maybe loss of appetite, some memory fluctuations, those kinds of things. And honestly, they could be indicative of a number of conditions. Diabetes, sometimes hypertension might get that fatigue. And maybe some dementia, early onset dementia. And among people age 55 and older who have received an HIV diagnosis, 50% had been living with HIV for about 4.5 years before they were diagnosed. And this is the longest delay for any age group. Okay. A few more things. Women who are older may not be worried about becoming pregnant, and so they're less likely to use a condom or to practice safer sex methods. Also, there's age-related changes, thinning and dryness of the vaginal tissue, and that could raise an older woman's risk for HIV. Because of the thinning and dryness, they might be at increased risk for a tear, and that opens up another entryway for HIV. And then we know that older people go to the doctors more frequently than other age groups, but they're less likely to discuss their sexual or drug use behaviors with their doctor. And we also know, and I know from my own personal research, talking to primary care providers, they're much less likely to ask their older patients about these issues. And that might be because they're much younger than the patient and they feel embarrassed about asking the questions, or they feel like they're ill-equipped to answer certain questions. And so, that's kind of holding them up from asking those important questions. Um, Also, learned from my research and others out there that, we have access to Viagra and Cialis and those kinds of things. And a lot of providers will provide those medications to their older patients without asking any questions. So it'd be important to know how many partners the person has, and if it's just for them and their spouse and those kinds of things. They should certainly be asking questions. And one other factor is we're seeing more divorce these days. It's more acceptable, and that's fine. But people are going out and dating again, which is also fine. Using websites like Our Times and Silver. I think there's something called Silver Time or something like that. These sites are specifically for older adults. And that's fine, but if they're entering into new sexual relationships and haven't had the experience in negotiating safe sex behaviors, then they could be putting themselves at risk for HIV. So I just want to share a little bit about aging with HIV infection. We are now learning a lot more about older people and people who are aging with the disease. Aging with HIV is wonderful because of these new medications. People are doing much better, but it also can present some special challenges. So people who have HIV and aging are increased risk for cardiovascular disease, some lung disease, bone loss, and some memory issues, as well as some forms of cancers like Kaposi sarcoma. So it's really important for older patients with HIV and their caregivers to maximize prevention efforts to try to avoid as many of these diseases as they can, and also to remain vigilant for early signs of any illness. It's also really important to be careful about interactions between medications. So nowadays, people are using HAART, which is highly active antiretroviral medications to manage HIV. And those medications are toxic and highly active, and so they might interact negatively with medications for hypertension or diabetes or those things. So it's really important for doctors to be on board and all doctors to be aware of what medications are being taken. And the pharmacist can also kind of help out with that. So I kind of alluded to this already. We're now just starting to see the long-term side effects of taking, antiretroviral medications for a long time. People were diagnosed in the early 90s or still living healthy lives, but we're beginning to be able to get some research on these long-term effects. And we do know for certain that these things can put a strain on the kidneys and it can lead to kidney failure. So you really have to work closely with your doctor to make sure that you're on the proper medications. Okay, so switching gears yet again, now to talk about COVID and HIV. So certainly if somebody's over 60 and they have many underlying conditions, they might be at increased risk for presenting with severe COVID complications. But there is some interesting research out there, and I will get to it just as soon as I talk to you a little bit about the actual life cycle of HIV and COVID and how they're very similar. So this is the life cycle of HIV. I'm going to go through it very quickly and just explain to you a little bit about how HIV enters and then begins to replicate. So the first step in the life cycle is binding. So basically HIV binds itself to the receptors of the surface of the CD4 cell. And the next step is fusion, where the HIV envelope and CD4 cell membranes fuse together, which allows HIV into the CD4 cell. Then there's a process called reverse transcription. So basically, HIV releases its enzymes to convert its genetic material of HIV RNA to HIV DNA. And then next step is integration. So at this point, the HIV enzymes insert itself and its viral DNA into the CD4 cell. Then becomes the process of replication. And so that HIV starts building long protein chains, and those are building blocks for more HIV enzymes. And then so once these enzymes are there, we've done the chains that have been built, we want to assemble. And so that's when the HIV starts to kind of push its way out of the CD4 cell. Once it emerges, it's an immature, ineffectious cell, but the last step is called budding, and that's when it connects to other cells and begins. There's more HIV enzymes throughout the body. So the same process pretty much occurs for COVID. Both COVID and HIV are RNA retroviruses, and so pretty much the same thing happens here. The virus enters into the cell, it releases its genetic information, it converts into proteins. Those proteins will start making copies. Then the viral portions become assembled, and then they start to emerge from the cell where they're still immature and infectious. But when they get out, it's when they start binding, and you start to see more of the infection in the body. Okay, so very, very similar process. With COVID-19, so these are some of the differences. With COVID-19, they have a single-strand RNA, and the host cell replicates its RNA, and the DNA is not involved. With HIV, there's a double-stranded DNA, and it inserts the DNA copy into the CD4 cell, and the DNA intermediates in the replication cycle. So this does involve DNA. And so this is the reason why you can get rid of COVID, but you cannot, as of yet, get rid of HIV because of DNA involvement. Okay? So I'm going to run through these pretty quickly. These are just some of the treatments right now that are being experimented with for COVID-19. The first one is remdesivir. This is just a broad spectrum antiviral medication that's been used to treat Ebola. It's been tested in fairly large samples of patients, and they seem to recover faster than those who did not receive the medication. There's dexamethasone. It's a common steroid medication. Again, it's been tested, and researchers have found a lower death rate in hospitalized patients who got a low dose daily as compared to those who did not. There's oh my goodness, these are so hard. Hydroxychloroquine and chloroquine. And these are two medications that have been used for decades for malaria and other autoimmune conditions. And there's been a handful of studies that have suggested that this has been helpful for those with mild cases. There's azithromycin, a Z-Pak. This is really common. I mean, I've taken it before for an infection such as bronchitis or pneumonia. There's also convalescent plasma. This has been done in China. I couldn't find anything here where they collected plasma from people who've recovered from COVID-19 and given that to people who were suffering from the disease or from the virus. And apparently within the 10 people that they tested it in, within 3 days, the patients had improved greatly. So that's another avenue that's being tested. There's also another I'm not even going to try to pronounce this one, but it's a disease-modifying rheumatic drug that's been approved for rheumatoid arthritis. So with COVID-19, people can have these cytokine storms in their bodies that ramp up their immune system to fight off the infection. And so they found some people with this medication by blocking the interleukin-6, the IL-6, it helps to calm down the immune system, and that's believed to help manage those cytokine storms. So this, I believe, would be used in conjunction with other medications. And then there's, again, and it's another antiviral medication. It's approved in Japan and China for the flu. There's been a couple in vitro studies that's shown that it's preventing human cells from being infected with SARS-CoV-2. So these are just two others. This is a study done in Greece using a medication for gout, which does fall
All right, give us 1 second, folks. I think we may have lost Dr. Davis. Let me just check in and make sure.
testing these medications. So,
Dr. Davis, we lost you for like a good 2 minutes or so. So could you go back to that last slide?
Yes. This one?
Yes.
Okay.
Thank you.
Sure. So what I was saying here is that this is a connection between HIV and COVID. So doctors in China, Japan, and Thailand are testing some of the HIV drugs that are being used to treat COVID. Sometimes there's a third one, which is in the second bullet point. I think I've given up on trying to pronounce these things tonight. But these drugs belong to the class of drugs called protease inhibitors, and they act by blocking a key enzyme that enables the virus to replicate. And so that kind of goes back to what I was showing you in the life cycle. If the virus isn't able to replicate, then it's not going to be as infectious. And so early studies really have already found that these drugs were helpful in preventing SARS, which is another of the coronavirus family, from maturing and replicating. So doctors in China and Australia are trying these medications in people that do not have HIV to treat the COVID, and they're seeing some success with that. So, does it really work? So doctors in Thailand have administered these drugs with large doses of Tamiflu, and they have seen success. So patients then tested negative within 2 days of taking the HIV medications and Tamiflu. And back making a connection to older adults, an older woman, a 70-year-old Chinese woman who was severely ill, also benefited and tested negative as well. And in Japan, a Chinese patient from Wuhan was treated with just the combination of HIV drugs, and their fever did subside within 5 days, but they were still having some breathing issues. So things to know is HIV drugs are not approved yet for the treatment. Several hundred trials are going on. And basically what we're doing now is testing what we have to see what we can use to fight COVID until we come up with a vaccine and a definitive treatment. So ART is, antiretroviral therapy, and this is the medications that people with HIV and AIDS take to kind of control their symptoms and the replication and spread of the virus. So in an unexpected finding, people living with HIV are actually underrepresented among severe COVID cases. And I found this to be extremely exciting information. And so I definitely want to share this with you, and hopefully this helps you make the connection between COVID and HIV. But there's two hypotheses. And the first one is that ART therapy that people with HIV are taking, like tenofovir, which is similar to the remdesivir that I talked about earlier, is being used in patients who are hospitalized. It's thought that these medications are blocking COVID entry into the system, but overall the immune system of people who have HIV is dysregulated. So it acts differently than our immune system, and that might actually be helping to suppress the COVID pathology. The same hypothesis has kind of been made, or they're looking for some observations among cancer patients because they also have some immune system dysregulation, because they're seeing very few, people developing severe COVID who have HIV. And I'm not so up to date on the cancer research, but it seems like that's what they were saying in one of the articles that I read. But I found it really interesting that people with HIV are really underrepresented among those with severe COVID cases. So I've said all this to say that these are all public health issues. Public health refers to the health of the population. And so certainly HIV, AIDS, COVID, and aging are all public health issues that deserve tremendous amounts of research. So there are huge research opportunities in terms of COVID by itself. As I mentioned, my colleague and I are doing a study looking at COVID and how it's impacted older adults. So there's opportunities there. There's tremendous opportunity with aging. As I mentioned before, the number of older adults is increasing significantly, and we're going to have so many seniors in need of different services and healthcare opportunities and those kinds of things. And then certainly opportunities with HIV and AIDS, looking at prevention, also medication adherence, looking at Truvada, which is now used as PrEP for the pre-exposure prophylaxis and those kinds of things. So we can look at these things separately. We can look at them all together. There's opportunities with looking at inequality and access to treatment, disparities, how socioeconomic status plays into it, diversity, racism, and then different treatment options. I know I'm really excited to look more into the connection between HIV and COVID-19. So with that, I will leave it and answer some of your questions. But I thank you for the opportunity, and I hope that I was able to make a good connection for you.
Thank you, Dr. Davis. So we have a few questions, so I'll just read them off on here. So our first question is, in 2017, a Daily Targum article cited collegestats.org, a website used by the U.S. Department of Education to collect and compare data between universities to aid prospective students. This article placed Rutgers as a university with the second highest rate of transmission compared to all American universities. A town hall was held on October 4th concerning the increased rate of COVID-19 infection, challenges, and concerning feedback from RU Student Health, stating that students have been either ignoring or hanging up on contact tracers, continuing to attend social gatherings without PPE, and walking in both large and small groups around campus without masks and other forms of PPE. Given the increased likelihood of infection with pre-existing conditions and the culture on college campuses, the possibility of COVID-19 infection for those who have contracted a sexually transmitted disease, this underlines the importance of understanding and proactive measures for those on campus. How can preventative measures be further promoted given this information?
So let me think. So I'm thinking at Rutgers, I was surprised to hear that because a lot of us have been moved to remote. And it seemed that New Jersey with the governor was having fairly decent success in at least keeping the rate stable and in some cases decreasing. But as far as actually, that's a really good question because one of the things I made a note of was that when COVID first came out, we really didn't act as efficiently as we should have. And I think younger people didn't take it as seriously because they thought it was, older people are going to get it and they have all the underlying conditions and they're going to be most affected by it. But we're learning now that younger people can as well, and especially older or younger people with, sexually transmitted diseases and those kinds of things. So I think there just has to be more conversation about it, but also like showing the data and perhaps having people who have had experiences talk about it with others. Because until you're really, we can see the numbers and that kind of thing, but until it's in your face, you really sometimes don't take it seriously. And I did hear about people like having COVID parties and those kinds of things. I didn't think it was here in New Jersey, but I heard about it going on in Florida, of course, because they just do whatever they want. My parents are from Florida, and it's crazy. But people, who would have a party to try to get COVID? Yeah, I don't know. I don't know, but I that is a good point, and I think more conversations and more. And the same thing actually, go back to HIV, that's my specialty. It's hard to get older people to realize that they can be at risk for HIV. So the way that we kind of try to address that is to share stories, have people who are living with the condition come and talk about their experiences and talk about when they contracted it, not that they got it when they were 20, that they got it when they were 65, starting a new relationship. So I think you have to have those anecdotal moments and stories and that kind of thing, but certainly more talking in classrooms and those kinds of things. Even if it doesn't apply necessarily directly to what I'm talking about in my class, I do try to talk to my students about it and make sure they're aware.
Absolutely. And I think too, to your point, I think people unfortunately don't address it or take it seriously until it's like directly affected them, whether it's themselves or like their family members and friends.
Yeah.
So our next question is, AARP has created articles concerning COVID-19, including increased depression following isolation. Technology has proved useful for the younger population to maintain a sense of community. However, the digital divide may prove to be a challenge to older generations to become accustomed to newer technology. How can the approach to new technology be ameliorated to decrease likelihood of depression for older adults?
So AARP actually also does technology workshops for seniors. It would have been great if we could have, had all seniors take these training sessions before the pandemic hit. So they do offer that. I think it'd be difficult. Although, well, yeah, I guess like the seniors I know in the senior apartment complex, they're not really that tech savvy. But now that it's a little, I guess, safer, they could do maybe some small presentations or what have you in their buildings and whatnot to show them how to use. A lot of seniors do have smartphones, just have no idea how to utilize it. So if they could give some training, and I'm sure once this pandemic is over, AARP will be slammed with people wanting to take these courses. But also senior centers have, training hours where they teach seniors how to send emails and how to use FaceTime. And they actually have it's not an iPad, but it's something like, it's called like Grandpa Pad or Grandma Pad or something like that. And it's specifically for seniors. It's only for making like FaceTime kind of calls and things like that. So it's really easy to use, but it's kind of like right now in the middle of the pandemic, it's kind of difficult to get these people into the training and get them on board. My dad's 75, my mom's 69, and we FaceTime just about every day. My fiance's parents are older too, and they're kind of getting into it. I've struggled with my aunt. She's 80 something. I most of the time just see the side of her head when we're talking, but I do plan to try to work with her because you're right, depression. So, people who have family that are calling and checking, that's one thing, but maybe their best friend was their only contact, and now they can't go to the senior center and nobody knows how to use the phone to FaceTime. Calling is the best thing we can do maybe in some cases, or sending a note in the mail. But certainly I think there'll be a lot of opportunities for training and things after this is passed. And so hopefully we can get more seniors to learn so that we can, because social isolation and depression is always going to be a problem for seniors. So.
Absolutely. And the follow up to that question, how can tech companies incorporate the needs of the older population into their product designs given the COVID-19 pandemic?
They can talk to the seniors.
And someone had also mentioned in the chat too that libraries also have training for seniors as well, depending on where you live. But the majority of libraries also service seniors in that way.
Mm-hmm. Yeah. So I think they're just talking to seniors and seeing what they want and how they operate, what would be best. Yesterday I did a home check for One Love Animal Rescue, and this older woman wanted to adopt a cat. Normally we do it on FaceTime or Zoom. She wasn't familiar with any of those platforms. So then she told me something about Duo. And so then I had to quickly download Google Duo, and she was familiar with that. So, I don't know what it is about Duo that makes it better for her, but maybe some of those technologies can be incorporated in other things. So just learning what works best for them.
Absolutely. The third question is, you stated that doctors in China, Japan, and Thailand have been testing drugs to treat HIV that have been used to treat COVID-19 and have proved to have positive results. Patients testing negative within 2 days, for example. If this research is replicated and efficacy increases, how can accessibility to this treatment be improved to vulnerable populations who have statistically seen a high prevalence of HIV? How can this impact affordability for treatment to those who are already suffering from HIV and may contact COVID-19? And can you foresee block grants being distributed concerning this?
So I think the HIV medications are fairly widely available. And I think I mentioned before that I volunteer at Action Wellness, which provides services for those living with HIV and other chronic conditions. And they're really, really good about making sure people have access to their medications. And they tend to serve the underserved populations as well. So I think going through, agencies like that, Action Wellness is actually doing COVID testing for people that can't afford to get a test. They're doing it for free. So yes, I would expect that, access, it might be difficult as it is with, other populations in that, but I think that the drugs are available, they're approved, they're already on the market for HIV. So, I would imagine we would be able to get those medications. But the good thing about it is the unexpected finding is that those with HIV are underrepresented, and perhaps because they're already taking those antiviral medications. So yeah, I think I could see that working. It seems like there's promising research on using this combination drug therapies. Tamiflu, I think, was the other one. And that's readily available as well. So hopefully we would have access, and block grants would be great as well. So
Awesome. And I think someone had posted in the chat too, their about Duo, saying that Duo works between different types of phones. Since iPhones and Samsung phones, you can only FaceTime on iPhones. So they don't work on different platforms, but Duo does. For anyone that likes to communicate with their grandparents or older family and friends, definitely recommend Duo to them, since we have some people that are definitely promoting
yeah,
the chat.